There is a good chance you know someone who is not feeling well, and there's a good reason why. The Wisconsin Department of Health Services reports respiratory illness levels statewide are high. At least one local medical group has instituted a temporary mask mandate for staff, patients, and visitors. And the state reported its first pediatric influenza death recently. What is out there, and how do we protect ourselves during this sick season in Wisconsin? Here to offer advice is Dr. Ben Weston. He is Milwaukee County's Chief Health Policy Advisor and an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin. Thanks so much for being with us.
It's good to be back with you.
When the State Department of Health Services says respiratory illness levels are high, what does that actually mean? And what is some of the stuff that's out there causing us to get sick?
I mean, there's all sorts of stuff out there. Like you said in your lead-in, everybody knows somebody who's sick, and a lot of times it's yourself who's dealing with something. We have flu and COVID are both picking up. Now, that's become kind of typical this time of year, but we see both of those ramping up right now. And then we have RSV, which we do have a vaccine for. We can talk about that. That's a new thing. But we have RSV ramping up as well that gives those kind of cold and flu symptoms. And then just to add insult to injury, we have norovirus, which does come around this time of year, but the levels are really high right now, which is more of that GI type of thing, which is miserable for anybody out there who's had it, and incredibly contagious. So you have all four of these in addition to all the normal colds and junk that's out there, causing a lot of people to get sick.
Well, the good news about this, if there is good news, is that there are things that we can do to protect ourselves. And let's talk first a little bit about vaccinations. There are vaccinations that can help us with some of these. COVID, for some people, RSV, for everybody, influenza. Kind of walk us through what those options are and who should be getting vaccinations for those illnesses where we can get some help.
Absolutely. So we could start with COVID and flu. Those are two easy to get vaccines. Pretty much everybody can get them, and they offer really good protection, especially against severe disease and hospitalization. And that's really what these vaccines are best at, is preventing people from getting really, really sick. And so it's good for everybody to get vaccinated, but if you really got to focus in, it's people who are higher vulnerability. And so we're talking about folks who are older, people with medical conditions, and then the very young, especially for flu, as we heard about with this first tragic flu death in Wisconsin. For those people, it's really, really important to get vaccinated. Now, RSV is a little bit different. So RSV is recommended for older age groups, especially people with medical conditions. And then pregnant women in certain stages of their pregnancy, certain times of year. So talk to your family medicine or OB provider for that if you are pregnant. But those are vaccine preventable illnesses. Now, norovirus isn't vaccine preventable yet. There's been talk of development of a norovirus vaccine, which sure would be nice. But norovirus is not vaccine preventable. The best way to prevent that is going to be just really good hand washing. Hand sanitizer actually doesn't work for norovirus very well. So it has to be soap and water, 20 seconds in warm water of good hand washing, especially before and after going to the bathroom and before eating, is going to help you to avoid getting norovirus.
Is it just also good hygiene this time of year? Because there are things other than the norovirus. There are some other colds and just kind of other respiratory things that are floating around. Can you beat good hand washing to help keep yourself healthy?
Absolutely. I mean, it's just a basic principle of hygiene and public health, washing your hands. And so it'll prevent all four of these things that we're talking about, particularly norovirus, but getting all sorts of viruses, even respiratory viruses can happen. We touch our faces all the time, all day long, whether you realize it or not. And so keeping your hands clean is really important.
There are also just seasonal colds that are out there as well. No vaccine for those, obviously. But what can people do if you got a cold and you're really feeling miserable? What are some things that you can do to help yourself feel a little bit better as you make it through the course of that illness?
Yeah, so it depends what you have. Now, certainly things like Tylenol or ibuprofen are going to be important if you have fevers or body aches from those flu-like symptoms. That'll get you feeling a lot better. There are cold and cough medicines out there that'll help. Some people like neti pots or nasal sprays or things to help with the congestion. So there's actually lots of medicines out there to help you feel better. You want to remember that in kids, in younger kids, really Tylenol and ibuprofen are going to be key. You don't want to be giving kids cold medication, over-the-counter cold medicines. But if you're not quite sure what to get, certainly pharmacists are an outstanding resource. Go to the pharmacy, talk to them, say, these are the symptoms I'm having, this is what I got, and what do you recommend?
When we take a look at those viruses and the colds and everything that's out there, most of these are things that we can kind of power through on our own. When do we need to reach out to our healthcare provider? What are some of the signs that we need to look for to say your body needs some more help handling what's going on?
It's a great question. So, like you said, for most people, all four of these illnesses are going to be bothersome, but not necessarily worrisome. That can change even in healthy people, but typically it's going to be you're older, you're younger, or you're people with some sort of medical issues, chronic lung disease, immune compromise, those sort of things who are going to get most sick from these illnesses. But for everybody, as you mentioned, it's important to know when do you have to actually reach out, see a doctor, or go to the emergency department, or things like that. Most people have a pretty good idea of their body, and is this kind of a typical sort of illness, or are things getting worse? But certainly, if you start getting, bad chest pain, shortness of breath, these are the kind of things that are much more worrisome, and you'd want to talk to your medical provider about. But there's lots of other things out there that you might not feel comfortable about with your illness, or you think something's wrong, and that's probably a good time to reach out.
I always hate to ask about this because we have enough else that's out there, but the avian flu,
Mm.
which is, of course, decimated domestic bird populations. We actually have had a human case of avian flu in Wisconsin. Is that something we need to be concerned about right now?
So here's what I would say. If you are, for the vast majority of people watching this, I think the answer is no. I would not worry too much about avian flu. I wouldn't lose sleep over avian flu. Now, the people who should worry about avian flu, one are people who work directly with bird populations or with cows. If you work on a dairy farm, if you work with wild birds or domestic birds, these are the folks who want to be extra cautious because those are the populations we're seeing it in. Now, the other group that want to be extra cautious are epidemiologists and public health practitioners and folks like that, because they do want to keep a pretty close eye on what's going on. What we worry about is that this could change. And instead of a virus that transmits from animals to humans, if all of a sudden it started transmitting human to human, it could be a totally different scenario. And so that's what we want to keep a close eye on. But for the everyday person who's not interacting too much with birds or cows or farms, I wouldn't worry too much. And if things change and you have to worry, we'll let you know.
All right. Well, we'll hold you to that. Thank you so much. We do appreciate the advice you give us on staying well during this very sick season. Thanks for being with us.
Of course, my pleasure. Good to see you as always.
Thank you. And we are back in just a minute. Stay with us.